Hello, Doctor.
Hello, Anne. Lovely to meet you.
I must admit this is unusual for me, but at this stage of life, I think it's time I be the one asking the questions.
Of course, please, go ahead.
I've been looking into facial rejuvenation, particularly facelift procedures, and your work stood out to me.
Thank you, Anne. I appreciate that. What would you like to ask me?
You seem to be one of the doctors in Dubai known for natural, elegant results. So congratulations on that.
Thank you.
I keep seeing all these terms, the Smas lift, high Smas, deep plane facelift. And lately, everyone seems to say that deep plane is the best option. Is that true? What's your output on this one?
We hear a lot today about the deep plane facelift as if it were the holy grail of facial rejuvenation, while Smas facelift techniques are sometimes presented as outdated. But plastic surgery has always evolved in cycles and trends. Every decade, surgeons move from one concept to another, often with the same certainty, until the next trend arrives.
I know exactly what you were talking about. It's like the fashion industry.
Yes, exactly. Ironically, when the deep plane facelift was first described and published, many surgeons criticized it and considered it too aggressive, unnecessary, or not reproducible. Years later, it became trendy again and suddenly turned into the gold standard on social media and marketing campaigns.
This emphasized the saying of, when you know your history, you know your value.
Absolutely. We saw the exact same phenomenon with BBL surgery. Years ago, surgeons were teaching that injecting fat inside the muscle was essential for better fat survival and long-lasting volume. Then, after multiple fatal embolisms and years of complications, the same community progressively shifted towards supramuscular injection and started emphasizing safety above everything else.
Actually, that is true. Yeah, I heard that too about Brazilian bat lift. The same surgeons who injected into the muscle decades ago are now pushing an ultrasound-controlled injections, right?
Yes, you're well informed. While if we keep injections above the muscle, we don't risk fatal embolism generally. We don't need ultrasound for that. Anyway, let us come back to our topic about deep plane facelift, because facial surgery follows the same pattern. After starting to dive deeper in the face in the 70s, surgeons spent decades refining Smas techniques: plication, Smasectomy, Smas flaps, vertical vectors, oblique vectors, low to high repositioning. Excellent rejuvenation results were achieved worldwide.
I know a lot of my friends still have amazing results with Smas technique performed years ago before the deep plane mania.
You're right, there is no proven superiority. According to my experience, releasing the retaining ligaments and mobilizing a thick, strong Smas flap with both vertical and oblique repositioning provides one of the most natural and powerful rejuvenations of the face and mid-face.
It's impressive to see how the progress wasn't just technical, but also artistic.
Let's put it this way. A deep plane facelift is not automatically better than a well-executed Smas flap facelift when it comes to overall facial rejuvenation. Where I do believe deeper work is often superior is in the neck. A deep neck approach can achieve more refined and durable contouring than a simple platysma plication or superficial platysma flap. But mastering deep neck anatomy does not mean skeletonizing the neck until it resembles a post-oncologic dissection after cancer surgery and irradiation.
Yes, I see sometimes these skeletonized necks, and honestly, I don't like it too.
Some deep structures deserve respect and conservative reduction rather than aggressive removal. And despite all the marketing promises, certain truths remain universal with both techniques. Platysmal animation recurrence can happen if the nerves are preserved. Nasolabial folds may persist if they are congenital rather than purely related to tissue descent. No facelift technique can permanently stop aging, and no trendy name replaces surgical judgment. At the end, the best facelift is not about choosing between Smas or deep plane based on trends. It is about having a smooth, safe, harmonious rejuvenation performed by a trained surgeon in both techniques and capable of choosing the right approach according to your anatomy, your tissues, and your facial identity, not according to what is fashionable on Instagram this year.
Thank you, Dr. KOTTI. That makes it much clearer. The best result is the one that looks natural, safe, and still feels like you.
Yes, exactly. Thank you for hosting me, Anne.